student Q&A. We have a couple of students of different years from Nova Dental with us today, so thank you for those students for coming in and joining. We appreciate the time and effort. So if you guys want to like go one by one and just introduce yourself, your year, whatever you want to say about yourself, you guys can go ahead.
All right, I guess I'll start. My name is Kyle Miller. I'm a D3, so third year at Nova, and I'm happy to be here, answer as many questions as I can. I'm a little bit far removed from your guys' shoes, but I still remember what it was like. So yeah, just anything I can do to help, I'll be happy to.
I'm Austin Jackson. I'm a D1 at Nova. Originally from here, and I can kind of tell you guys kind of an insight on how D1 year is at Nova and how it's been going with COVID. I'm happy to be here, and thanks for having me.
Hi guys, I'm Bruna. I'm a D1 at Nova, and I graduated from UCF. So I'm really happy to be here as well, and I hope this session is helpful for you all.
I suppose it's my turn now?
Yeah. Yeah, I did.
Okay. Yeah, I'm a D2 student. My name is Carlos Llanes. I was a Panther, now I'm a Shark. So I did my bachelor's there in FIU. Anything you guys need to know, you need to ask, we're more than glad to help you here, okay? So, go ahead.
Okay, is that everyone? I think everyone spoke, right?
Yeah.
Okay. So if you guys have any, like, whatever your questions are, you can either drop them in the chat or just unmute yourself and, you know, ask your questions. And yeah.
On mute.
Yeah, you can take advantage of this because I remember we had this, like, I think it was last year, and it helped me so much. So take advantage of this opportunity, ask all the questions you guys have, and yeah. So you guys can start whenever you're ready.
I guess I'll ask first. Okay. So how did you guys prepare for the DAT? I'm like having a hard time, you know, managing my studying and my classes. So yeah, how did you like manage your time with your classes and study for the DAT at the same time?
You want to go, Austin?
You want?
I'll go first, I guess. I guess how I kind of prepared for it was I actually did it during the summer. I studied for about 2.5 months. I did DAT boot camp, and I kind of made that my job, at least like doing like 8 hours a day for 6 days a week. Then usually I take a Sunday off, and probably like a Saturday I go out with like people on Saturday. So as like a little rest. But I just basically made it my job because I played lacrosse in college. So taking it during the school year was a little tough for me because I already had time commitment outside of just school itself. So I took it during the summer, 2.5 months, and then just put my whole life into it because you don't want to take it more than once. And if you do, that's fine, but it's best to put your whole life into it the first time because then it'll just make your life easier and you won't have to go through another 2.5 months of studying because there's as you guys probably know, there's a 3-month wait on taking it again. So if you don't get a score you want, you have to wait another 3 months to take it. But that's how I kind of went at it. And I used DAT boot camp the entire time, and it worked its way. It did its magic. They teach you so many tricks. I mean, I can't thank those people enough who made that. But yeah, that's what I did.
Yeah, I used iPrep. I don't know if you're familiar with that, but I thought it was such an amazing course. It's kind of expensive, but it's like Austin said, you don't want to take it again. So invest right now so you don't have, because the exam itself is really expensive as well. You have to pay like almost $500, right? Something like that. So like just invest your time, have a schedule, study every day, have rest when you need to, but make sure you have a schedule and you know what you're doing. Yeah, iPrep, I'm sorry, I saw a question here on the chat. Did iPrep help you with math as well? I feel like it's more focused on the sciences. Yes, I also used boot camp, but math wasn't my strongest session right here. I thought I would be so good in math, but it wasn't my strongest one. Um, I don't know. I didn't really use her math session. I just focused on the sciences because that's what I heard people saying. But I know people that just used iPrep and they did amazing. I don't know.
I mean, I could also comment on iPad. I had a ton of friends take that did DAP bootcamp the first time, didn't do their best. I don't know if it was them investing time, but then they took iPrep and they were really like, dang, that's like this software, like, or the lady who made it teaches you so many tricks behind the DAT where it's like, if you're caught in between like a 50-50 question, it gives you like that like little blurb to kind of get you there to the answer. So
Yeah,
I mean, obviously iPrep is like becoming the bigger, I guess one to use, especially like down here in Florida. I feel like I always hear like people taking the DAT from in Florida that they constantly use iPrep, and that's that one they actually told us to use when I was an undergraduate. So
yes, people at Nova usually recommend that you use iPrep. So yeah, I think most of the people used it. Do you remember your average test score? Yes, I got a 21. So what I hear people saying is that a 20 plus, you're safe. If you get a 20 plus, it's fine. So yeah.
I also got the 21 as well. But don't worry, there's plenty of people that I know personally in dental school that are completely my friends in our D1 class that got lower than even a 20. So, and it's not all about your DAT score. Just you want to do well to show them that you're there on paper, but it really comes down to your interview. So it's not don't worry, like it's not everything. Like if you don't get like a 20, it's not the end of the world. Like still apply.
If like just to jump in real quick, like thinking back, like I took it during the school year and was like, I don't know, I feel like everyone in this field is used to performing well in classes, and you guys are all overachievers. Like you want to do amazing in everything. If I had advice, I would say like you've had three years, or I don't know what years you guys are, but you know, you've had multiple courses, you've taken a lot of credits. Like if you have one okay semester versus one great semester, and you explain, hey, I was studying for the DAT and I prioritized that, not so much over your academics, but just like understand that this test it's not the end of the world, but it's going to it should take precedence over getting that A or A plus in the courses, in your undergraduate courses. Like this can differentiate you between getting into dental school versus not, as where, you know, pass your classes, but getting an A plus in Orgo 2, it doesn't mean anything in dental school. You know, like I just treated patients. It doesn't mean anything. So focus on like your future versus like look towards the future versus the nearsighted, like what kind of how you're used to always performing well, being a perfectionist. Like don't beat yourself up, like give yourself, you know, patience, and like know that like you don't have to be amazing at everything. Just focus on the DAT, you know, pass your classes, do okay. And then if that comes up in an interview, hey, this semester is a little bit lower than the rest of yours. Hey, I knew what I wanted to do and I focused on the DAT because I knew it would get me here. And that's a very like, I think intelligent answer to give an interviewer if you want to do that. But otherwise, study during the summer. Like, but you can't be the best at everything. You can't do it all. Like, and don't try to be, because you're gonna kill yourself studying for the DAT in all these classes. So that's my 2 cents.
Do you want me to jump in? Hi.
Yeah, go ahead.
Well, I agree a lot with Kyle and the rest of the students. When I took the DAT, I'm going to tell you just not to make the mistakes that I made. Not that I had to repeat it at all, and I actually got in my first interview. Any school that I applied to was good. But the mistakes are that you have to take a break. Like, you have to rest. Like, not waking up at 4:30 in the morning, going to freaking study, then after that, study until like 12, say midnight. So as you can tell, I was sleeping like 4 hours for 5 months because I was working. So, but I still had time. So don't do that. Just try to, use the time effectively. Sometimes when you study more like, I don't know, I'm saying like 12 hours or something like that, you're just wasting your time. That's what I think. So I used iPrep and boot camp. They were great. I love boot camp for the PA, how do you call it? PAT. So, and my scores were fine. Were in the 20s. And I still got in. Math was bad. So I don't know if these dental schools actually look at math so much. I didn't study as much math. So that could have helped me more in my AA, right? So that's basically what I did. Hello?
Okay, so
Okay, how did you guys prepare to apply to dental school? Well, guys, my experience was kind of different from everybody else because I applied really late. I don't recommend that you do that. I took the DAT while taking 17 credits, so like it was crazy, guys. I don't know how I did it, but just prepare and apply early so you have a room, you know. And let me just give you a tip. When you're applying, and let's say you apply to Nova, I guess you all are interested in Nova here, let them know that you really want to go to their institution. Show them your interest, that you love Nova and everything about it. Because really, guys, everybody here is so friendly. Tell them that you like the atmosphere, because it really shows that you're interested, and they don't want to give you an acceptance and then you just don't want their institution, you know what I mean? So like make sure you show them that you want to go there. And if you can attend their pre-dental days, I don't know if they're doing that anymore, but like when they do, pay attention to that and attend their pre-dental days, go to their events, because that really shows your interest. How was interviewing at NSU? Do you want to go? Anybody wants to go?
I guess I can kind of go with that. Interviewing at Nova, it's really relaxed, honestly. It's probably one of the most relaxed interviews you'll get in your whole dental interview cycle. I honestly couldn't believe it when we had it. Like you see all the, I'm sure you guys have seen it, like Student Dental Network, or like you guys reading all the blogs, like most people do. They always say like, oh, Nova, like super chill interview. I didn't really know how to take it because it was super chill. But I mean, it truly is really just a conversation. And I just really want to see if you're a normal person, honestly. That's how you'll realize, like when you do a bunch of them, that the questions are similar at each one. They're just really trying to get to know you as a person. So like, I mean, don't fake yourself, be yourself. Like that's the best advice you can give when you do those. And honestly, the people who interview you for Nova are some of the nicest professors that you could possibly ever have someone interviewing. Like Dr. Hack, Dr. Galka does interviews, Dr. Quinton does interviews, and they're like, and Dr. Littman, I don't know if he's still doing them, but he generally was like the dean of students, like the ones who I guess was accepting a lot of them, but Dr. Galka is taking that role now. And as Bruno was saying, you guys, if you really do want Nova, let them know that Nova has like a piece of your heart. I mean, I personally, Nova is where I really wanted to go. And I had friends who constantly would go visit Dr. Littman, and before I did, and they would just constantly let them know, like, hey, I really want Nova. Like, this is where I want to go. And they would go. I mean, you can even like email them and be like, hey, do you mind like having a meeting with Dr. Galka? And then I had probably a meeting with 3 times with Dr. Galka post my interview. I was so honestly, they probably hated me because I was so psycho, because I wanted Nova that bad, but I was constantly like updating them with my grades pre-December. And even if like post-December you don't get in, keep going until they let you in. Like, I don't even know how to say it. Like, we had one of our friends in our class, Jana, like she literally went 3 times at post-December to let them know. And she got in I think like March or something like that. But like, I mean, it's just like that. If you really want them, I'm sure, and you worked hard in undergrad, you're going to get in.
Yeah, I mean, right now with COVID, I don't think they're taking like meetings. But if you email them and say, hey, like I am really passionate about this, I like want to go to Nova. Could I like have a Zoom conference call with you and just ask you a few questions about the school or whatnot? Taking initiative is huge, you know, like that's always what people recommend, especially like if you want something, just go for it, like you said. So I think that's like, if you want to set that up, Dr. Gauka is so nice. Like she'll 100%. She's kind of like germophobic. So during COVID, she's not going to meet with you in person. 100% not going to do that. I know that for a fact. But she's a very nice lady. If you want to talk to her, she's available for sure.
Okay. Are there a lot of dental students who aren't bio majors at Nova? Do you guys know that? I was a bio major. I was a biomedical scientist.
I know a lot of people who weren't. I was a neuroscience major. And I think like not being a bio major is actually a good thing because it sets you apart during interviews. And at a lot of different places that I interviewed, it allowed me like just something to talk about that not everyone else is talking about, you know? So if you're not a bio major, even if you are, it doesn't matter. Like as long as you are, you know, passionate about what you're doing and can speak to it and why you're doing it, then it's going to be fine. Like if you're a journalism and you decided you want to do dentistry, that's cool. Like it gives you something to speak to. So majors don't matter. Like you want to be a dentist. That's all that matters.
Yeah, that's what I did when I had Lakeman in my interview. I was the last person that day. It was hello.
Hello.
Can you hear me? Yeah, I'm sorry. Yeah, I was saying I was the last person that afternoon. It was like 4 p.m. and I didn't know I had Liedman. And then he went to me and he grabbed me and said, "Listen, you got an interview with me." And then what I did, you know, I would say I'm one of the oldest of my class. So I come from a different background, no medicine at all, no masters, just a bachelor's in biology. I'm Cuban, as you can tell. I came here, you know, quite a few years ago, like 7 years ago. And I came to see only once Lippman. I talked to him before the interview. Then my girlfriend is also here with me. She got in with me. We're together here. And what I did was I tried to tell him my story, like who I am. I didn't want to even mention being a dentist is a dream. I love helping people, stuff like that. Like you do it, but in a different way. You know what I'm saying? That it doesn't sound so artificial. Like it sounds very natural to you. You understand? That's what I did in my case. So, and he actually talked to me. He said, I like when people tell their story, you know, in a way that I like to hear about, you know, and they can interact with you and ask you about. That's what they're trying to do. They're trying to know who you are, who they're going to bring into the school. I think is an important point to know.
Okay, so there is one question here. What does NSU expect of us for shadowing this cycle? Before I applied to dental school, Dr. Lippman went to UCF and he spoke to us and he talked about shadowing hours. And they're not big on shadowing hours, guys. Dr. Lippman even said, put the minimum, like if you're applying to, I know UF is really big on shadowing hours, so like you gotta have many, but Nova, they don't really care. What they said to us was that we are gonna learn dentistry at Nova, at dental school. So like it didn't really matter how many hours you had before, but if you're applying to more schools, just be cautious and see what they recommend. What else? Can I go to the next question? Yeah. Someone asked, do you know if Nova acceptance rate is easier since it's a private school?
No, I don't think it.
Yeah,
Well,
I think dental school is expensive, like even if
yeah,
it's private
as
or
far as
not.
the acceptance rate goes, I think it's pretty uniform. Like different schools have different criteria that you have to meet. If you want to go to Harvard, get your 28 on the DAT. But like the acceptance rate, you can see the stats of every school. I think the average DAT for Nova is, people get 18s and get in. People in a kid in my class got an average of 26. So I think it's like a 22 or something. The scores are there for each place. Acceptance is uniform throughout. The only difference that being private makes is tuition. So in-state and out-of-state students pay about the same. It's like $1,000 difference. State schools, in-state's much cheaper, and they tend to favor having in-state students there versus out of state. It's harder to get in if you're out of state to a state school. Private, it's pretty uniform for everyone.
Mhm. Okay, there's another question here. What extracurriculars have you done and recommend? Being part of pre-dental organization is amazing, guys. It looks really good on your application. I also was part of a community service club. I had leadership positions there. So like, what about you guys? Did you do anything else besides like studying?
I recently went to Colombia like a week before COVID hit for a mission trip,
Nice.
but it was more like a medical mission. I didn't really I shadowed a dentist there for like an hour or two, but it was mainly focused on medical. So I don't know if that is like a big deal for dental schools.
I also did a mission trip, but it was dental. But I don't think it should matter if it was dental or medical. I think it looks good both ways.
Yeah, it definitely looks good both ways. I think it's just getting out there and like serving the underserved. That's like the whole point of those. It's like why we go and do those, serving the underserved. So I don't think it has to be dental related, to be honest with you. Like I'll be honest with you guys, my whole resume said medical school, medical school, medical school, and I went to dental school because I didn't know relatively what I wanted to do. So I did like shadowing in the ED. I worked in the ED for 2 years doing scribing. I shadowed Nancy's college. And I didn't take time until probably my senior year to realize that, hey, maybe I don't like working in a hospital environment. And one day they let me go scrub up with an oral surgeon while I was scribing. And I was like, hey, this is really cool. Maybe the dentistry field is something I'd be more interested in. And so I went to try to go see a general dentist and a perio right after that, because the perio and the general dentist were together. And I was like, wow, this is it. This is what I want to do and love. So basically having your thing entailed to dentistry necessarily isn't the end game for you. I mean, I constantly got, when I went to my interviews, why dental school? Because my whole application pointed medical school. But it does, again, it's a saying that like your major is finance and you have a minor in biology. It's not going to be the make it or break it. And if anything, like Kyle said, it's going to be a great talking point. So I think anything you do to serve the underserved is great. It's all going to look the same.
Yeah, exactly. Yeah, Nova is pretty big on helping others, like showing that you care about other people. It's great for every dental school because it's all about our profession, right?
Yeah. If there's one like advice I could give to that, it would be a lot of people try to stuff their resume like with, oh, I did 1,000 different things. But when I went to interviews, they're not going to ask you about every little thing. They're going to ask you about what would you want to talk about? Well, if you've done 1,000 things but only spent an hour each place, it's much better to invest a lot of time into one thing. Like I did dance marathon, and I'm from Indiana, so I'm completely like out of state, like found Nova, applied, and like came to an interview here and loved it. But at a lot of my interviews, most of the time tend 10 to 15 minutes was spent talking about that one thing because they could tell I was super passionate about it. And it spoke to like, I wanted to help people. I wanted to like serve, and I wanted to like work with kids. So that's why dentistry. And it's so much easier if you're just like, hey, like I love this one thing, so I put a lot of time into it, versus being all over the place but not really experiencing anything. You know, a lot of kids try to do too much, and it's like, just invest yourself, help others, and be able to tell a story about that, and that's huge.
Yeah. Can we go to the next question? I see here. How much more difficult is dental school from undergrad? I don't know, guys, because honestly, I graduated this summer. So let me see. I think it's just different in a way that you don't have that pressure of having to apply to dental school because you're already in. But yeah, the workload is intense. We have so many classes, and us, like we've been studying for like so long, every single day, like 8-10 hours for exams. We have exams every single week, so we finish an exam, we are already studying for the other one, and it's just, it never ends. It never ends. But it's just nice, just knowing that you're doing what you love, you know, and not having that pressure of having to apply to dental school because you're already in dental school. So I don't know how to scale it, like in difficulty, because it's just different.
It's different. Like, we'd be lying to you if we didn't say, I don't know how it is for you guys this year because it's been different because of COVID. It's a lot harder. Like, and it's not something to be afraid of. It's a challenge that like you should embrace, because what I found is like, I'm in clinic now and I'm treating real patients, but I miss the times like when D1 year, when everyone, like my entire class, would be at the library all weekend. And like we would just, it's a thing. You're there all the time. It becomes your life. So like your class is going to be your best friends. Like, and I'm from out of state. It was awesome. Like I spent 24 hours a day, all week long with these kids, and it's to study. And it's like, it'll kick your ass at times. And it's sometimes like very like almost heartbreaking that you're like, God, I'm just like, sometimes it'll beat you down, but also like it brings you together with your class a lot. And at the end of the day, you're all going to get through it. It's like a really fun, like awesome, terrible experience, I guess. Like it's hard, but it's like you embrace the challenge. Like it's going to be different from undergrad, but it's good. It's awesome.
Just knowing that you're not alone. Everybody, your whole class is going through it with you. It makes it a little bit easier.
Yeah, there is I agree a lot with Kyle. There are two things up to now that I will never forget in my life: DAT, D1.
Yeah.
That D1 year was crazy. Like you have, as Bruno was saying, we have exams, like 2-3 exams, in 1 week, and you're gonna say like, damn it, like 15 chapters or 10 chapters for a weekend. Like the whole cardiovascular system for a weekend, you know, and things like that. And you say, yeah, you don't breathe. And hopefully if you have a student partner, that'll be great. You're going to fight, but you're going to become the best friends at the end of the day. My business partner is my girlfriend. So we don't have an anniversary. We don't have a dinner in D1. We don't have a dancing date, nothing during that first semester, because you don't want to fail. You want to do as good as you can, obviously learn, embrace the challenge, as Kyle said, but you won't forget it. It's hard. But that's why I always say the DAT, multiply that times every week you have in D1. If you study very intensely for a DAT, okay, that's simple, just preparing you for you to face what you have in D1. It's not that you cannot do it. I always say, if Lippmann, whoever picks you to come to Nova, it's because you have the actual everything you need to actually pass and go through the D1 year. Absolutely.
Yeah, I guess I can piggyback off what Carlos said. Basically, like the data is basically to see how well you can study a massive amount of information in a little time. Because it's a total composite test, right? So you're cramming a ton of stuff in for a lot of time, and that's literally since Bruno and I are going through, that's what D1 year is. I mean, they just give you a certain amount of chapters, and they're like, hey, you have a week to study this, and basically, like for our first biochem test, it was 24 chapters, and it was basically all undergrad biochem in 24 lectures.
In anatomy as well, like we learned the whole thing. I was like, for the first exam, I was like, what is left to learn? We learned the whole thing about it.
So I mean, that's just how it goes. I mean, but the thing is, again, people are suffering with you. You're having at the same time, like one person will break down and you'll be like, you're good. We're all here with you. Like, take a walk.
Yeah, you make such great friendships along the way. It's a nice experience. It's hard, but it's nice at the same time.
Oh, one of the things, I don't know if you guys agree with me, is that you have a lot of exams, a lot of content to cover, but you still have to carve a tooth.
Yeah.
And that's very frustrating.
Yeah.
Right? So like you have to carve a tooth and you say, oh my God. When, you know, like you say that, well, I have hand skills, I can do it, no problem, I've done it. But when you get the first block of wax and you see that it comes out everything except a tooth, you have to be frustrated. You know, so be ready for that.
Okay, guys, there's a question here. I'm not sure how to answer this, but are they allowing students to visit and talk to the dean during this time?
I think Kyle answered that. I don't think Dr. Galka is a germaphobe. Like I remember when COVID was breaking out, I went to see her in like March, and she was just like, back away, like give me my space a little bit.
Yeah.
But I'm sure you can email them. I don't know if they're technically like seeing people as of right now through COVID. I really don't know how COVID working, but pre-COVID, they were constantly seeing people as long as you like wrote Beatrice a message to coordinate with Dr. Galka.
Next
I would just
question
reach
is-
out and.
I'm sorry.
No, you're fine. Just reach out and, you know, and say, hey, like are you taking meetings right now? And if they say no, suggest an alternative, suggest a Zoom meeting or something like that. Because I mean, Dr. Galka definitely is a germaphobe, but people have different reactions to the current, you know, situation. So I would just say be respectful but be persistent. And I'm sure you'll find a way to talk to who you need to.
Yeah, Kyle, you just reminded me of something. My friend, when I was applying to dental school, he also wanted to apply to Nova, and he wasn't sure if he should apply. So he set up a phone meeting with Dr. Lipman at the time. So I guess that's a good idea as well, like just calling them and talking to them. Everybody here is so friendly. I'm sure they would.
Yeah, there's so many alternatives, and they'll be so open to helping you guys. So don't worry about that.
Okay. The next question is, what is the day-to-day life of a Nova Dental student?
Bruna covered that. You were on the ASDA page.
Oh, no. Guys, we wake up, we watch lectures, then we study. That's what we do. Like, you have to find time to work out, like, do your thing, keep the balance, you know. But yeah, that's basically it, guys. Studying, especially D1 and D2 years. I think those are like the ones that have more lectures. You can answer better than me, Kyle.
I mean, yeah, so D1 year is essentially when we were doing in class. So right now, you guys are not doing in-person lectures, right? You're still over Zoom.
Yeah.
So they have lectures. I mean, you look at your schedule and it's like, at first you're like, I remember getting my schedule and being like, what? Like you're 8 to 5, like Monday through Friday. There are some breaks in between. Some days you get out earlier than others. But you're 40 hours a week. You're either in lecture or you're studying. And that's like, but it's not terrible. I mean, like there's times where you have breaks and whatnot. But that's your day-to-day D1. D2 year, it kind of changes to where you're not doing so much science anymore. You're in a lot of the more dental related classes. You're in periodontology. a lot of things like that, as far as a few different lab courses a few times a week. So, and I guess D1 year too, you're in the sim lab twice a week, doing different, you start out with wax ups, tooth carving, then you start doing some restorative things, getting some hand skills. And then by the time you're in my shoes, they say, okay, we'll go treat real people. So it's been really cool. Like you don't feel like ready, but you are. So like day to day for me is I wake up, we still have some lectures, and then I'm either, most days, Monday through Friday, I'm either assisting a friend who's doing a procedure on a patient. I'm working on clinical cases for my patients, preparing denture bases. I'm in sim lab a lot of days because I have future treatments that I've planned with professors that I'm going to do. So if I have a patient on Friday, a lot of times on Wednesday or Thursday, I'm going to get into this lab and practice that procedure. But by D3 year, life is good. Like I no more tests. Like I go to happy hours. I go to the beach. It's a good life by the time you're at D3. So guys, you'll
Can't
make
wait. I
like,
can't wait.
yeah, I know, but even like D1 year, like I think Bruna said, like you got to find balance, because there's some people in my class that you can go crazy at times because you're so preoccupied with studying and whatnot that you forget about yourself, and you forget about like your mental health. I'm sure you guys studying for the DAT feel like that. Like your mental health is very important. You got to find time to go to the gym, spend time with your family, your significant other, like whatever your vibe is, whatever you like doing to relax, do that and find time to do that. And know that like taking an hour off or a night off isn't going to kill you. Like you have to put those in, or like this should be a good experience. Like I want to think, especially like the way I looked at it was like, I want to look back at dental school, not middle school, dental school, and be like, that was like 4 of the best years of my life, not like it was absolutely miserable. So I don't know, day to day it varies by year, by day, but it's really cool because you're at a place where you're learning every day. You're learning so much every day. Like it's crazy fast paced how much stuff you take on. But it's good.
Okay. Let's see.
I think we have a lot of questions in this chat.
Yeah, I'm reading them here. I'm trying to go in order. So let's see.
You guys have, I was gonna say, if you have a question that relates specifically like to a scenario that you have, like a personal question, if you want to directly message like us, that would be more beneficial than like trying to go through everyone's questions. Like,
Yeah.
let's try to keep the general questions to things that can relate to everyone. And then if you have a more specific question, just message us in the chat directly and we'll try to answer you.
Okay. Yeah, someone asked, what would you consider the most important thing that gets you an interview? It's the whole thing. It's a holistic approach. Your scores, your extracurriculars, it's everything. Is it necessary to obtain a master's before applying? No, not at all. Depends on your GPA. If you have a really low GPA in undergrad, you should consider doing a master's. Does anybody wants to add to that?
Yeah, I mean, I can add to that. I did a master's. If you guys have any questions about masters, I can answer those questions for you. But yeah, I mean, I did a master's. I didn't have that bad of a undergrad GPA. I had 3.3, but for medical school, I thought I was going to medical school at that point. So, and at that point, I wanted to go to an MD school, and 3.3 doesn't cut it for an MD school. So I went and got a master's, and then while I was in my master's, I figured out that actually dentistry was what I wanted to do after they let me scrub up. So if you guys have any master's questions, I'm more than welcome to answer those in like a direct message.
Okay, there's someone here asking about the tuition. Can you guys please talk about the loan after you graduate, and how long it would take to pay off $500K? It hurts. Um, does anybody wants to answer that?
I mean, I guess like I've done the math and it's a lot of money, but I don't know. Like I don't want to sound arrogant, but like the income potential of the profession you're going into, it's not a problem. Like if you whether you work for someone else, like it's not going to be a problem paying off that loan. Like if you work private practice, go to work for a different corporation, if you specialize, like that should never be, you're going to be paying it off. You can pay it off aggressively. I know like I've been in seminars where they talked about paying it off aggressively. I've been in other seminars who said, no, if you want to buy a practice, pay it off super slow and then build up cash so that you can show the bank, hey, I have capital. I want to buy this practice. Can I have this loan? I want to specialize. By the time I'm done specializing, like I'm going to be like 800K. Like I'm going to be like so far in debt, but at the end of the day, like I could probably pay that off within 10 to 15 years. And it's not going to take a huge like hit on your income. Like don't worry about the loans. It sounds crazy to like a normal person, like to someone who like $500,000, like, but this, you're becoming a professional and society values us very highly economically. Like, so it's going to be all right. Like
the way I see it is, you are investing in yourself, right? Yeah. Let's say you invest in a restaurant, you invest in a factory, you invest in whatever, you just investing in yourself. So that's the way I see it. I don't even look at how much I have to pay. I look at how much I want to gain because I want to earn, hopefully. So it's an investment that you have. That's it. Investing on you. Nothing better than that.
The banks wouldn't be giving you that much of a loan if they didn't know for a fact that you were going to be able to pay it back in the future. So
exactly.
Yeah, people can take away from you everything, but your degree is yours. So try not to worry about. I know it's hard because I look at the debt and I'm like, oh my gosh, how am I gonna do it? But like, try not to worry about it and just everybody's in the same boat.
Yeah.
Okay.
I think that's the last thing once you're in dental school. I think that's the last thing on your mind. It really has not crossed my mind one time how much I'm paying for dental school, because once you're in it, that all flies out the window. And in dental school, you learn to take problem by problem. Honestly, truly, each week's a new problem, and that's the way you're going to assess it, right? So it's good to look forward at things and thinking about how you're going to pay that off, but you're truly not going to. They're going to tell you your experience as you progress through dental school and how to run a productive practice and really get those loans down. But it's something good to think about always. But again, like Kyle said, they wouldn't give you the loan if they didn't know you were going to be able to pay it off.
Mm-hmm. Okay, what are your guys' opinions on gap years?
Gap years, our class has tons of people that did gap years. So gap year's not a bad thing, guys. If you need more time to prepare for dental school or get your application ready, take that time. You don't have to be that person right off the bat that gets into dental school. There's so many people in our class that the age range varies, and everyone comes from different backgrounds, so it's not a big deal. If you need to take the time to prepare for dental school, you can.
Yeah, I personally took a gap year because I was in business school for 3 years. I hated it. I switched my major like after 3 years of business school to a different thing, and then I thought I was going to go to med school. So it was like, take a gap year if you need it. You know, it's case by case. Like if you want to take a year off to like just chill, don't do that. Like apply if you're ready to apply. They're never going to like. It doesn't hurt your application to say, I took a gap year to focus on studying for the DAT, maybe take extra courses, maybe improve my resume. Like that shows self-awareness. Like if you need a gap year, do it. There was no way I wasn't gonna, like not take a gap year. But it doesn't matter. Like it doesn't hurt you at all.
Okay, there's another question from Daniela. Should we shadow different specialties, or is it okay just to shadow one general dentist?
I think that's a good question, honestly. Definitely shout out general dentist first, because you don't want to tell like the admissions committee like, hey, I'm only going to dental school to specialize, because not everyone's going to specialize at the end of the day. So you have to be okay with not specializing. So I would definitely shadow a general dentist first, and then kind of get into like the specialties. But don't just shadow only specialties and then just no general dentistry. That wouldn't be the right way to do it.
Yes.
Yeah, but you can, you just shadow whoever. Like you can shadow general dentist if you have one person you've been shadowing, you have all your hours with them. It doesn't really matter. You can diversify if you want and see some specialties, but I think as far as Nova goes, like shadowing, they know you're standing there for 4 hours. Like you don't know what's going on. You know what I mean? Like unless you have a really good dentist who loves to teach, it's basically you're putting it on your resume and you're meeting that qualification, moving on. You know, like it's not something to get caught up on, especially with Nova.
Yeah, exactly. Especially with Nova, because I don't think they really care about shadowing hours.
Yeah, no.
Yeah. Next question is, how many letters of recommendations should you recommend turning in with my application? Okay. Let's remember. I think it was 2 science letters and 1 non-science and 1 from a dentist, right? Am I right?
I think that's uniform, just like as far as the application to any school goes. And
Yes.
It stays
absolutely,
constant.
yeah. They're turning more in. I don't think really helps. Like if you there's that requirement. Like you have to have these letters of recommendation. If you don't turn them in, I don't even think they're going to process your application like through the portal. So obviously have whatever it requires. If you have more people, you can do that. But like the biggest thing about letters of recommendation is have good letters of recommendation. Like if you're with a science professor and you're in a lecture hall of 400 people and he doesn't know, or he or she does not know who you are, even if they're willing to write it, do not ask them to write it, because it'll be generic. And like try to find professors that are from smaller courses who you've made a personal connection with, who know you, know your character, and know how hardworking you are. So like make sure that the people you're asking are in a position to really like brag about you, and not just someone that who's willing to. I think that's more important.
Okay, perfect. I see there are some questions here. There are more like personal questions, so I'm just gonna skip those. I'm sorry, guys. It's just because of the time. But let's see. Do you guys want to talk about the specialties program at Nova? Because somebody is asked about it. Endodontics.
I think Kyle's the one that knows more about that. It's already in clinic.
What can you tell me about the endodontic program?
Yeah.
Also, how the honor and advanced courses at Nova. So as far as the residency program goes, I know we have like, if you're interested in endo, we do have a really state-of-the-art endo department. Like it's sponsored by maybe Shine. It's really cool. Like a lot of the specialty programs are upstairs, and they have like their own little wing with all of their like microscopes. Like they do all of their endodontics through these high-powered microscopes, like not even like loops. It's like they're looking at a microscope right into the root canal, doing that. So it's definitely like state of the art. It's cutting edge. I think most of our residencies are like that. They stay pretty advanced and up with the times. A lot of people that I knew that have graduated recently have gone on to do residency programs at Nova, and they really like it. I just think that when you get to that point, for me, it's like residency, it's going to be where I can get in. It's going to be like, you're going to learn a ton at that program. It's very difficult to get into residencies. So I wouldn't, even like they're great, like at Nova, they're wonderful, like, but don't get ahead of yourself and just focus on dental school right now, because what you think you want to do most likely will change like throughout dental school.
Yeah.
I came in thoughting I loved peds. I don't want to do peds so much anymore. Like a lot of people are like that. You'll find your passion in dental school when you're actually exposed to different patients, populations, and different like experiences. A friend of mine wants to do pros now, and our first year of dental school, she was like, my grandma has dentures and it grosses me out so much. Now she's like, I want to do a prosthodontist and do dentures all day. Like, so it's going to change. But yeah, they're awesome at Nova, I guess, if that answers your question, I think. But, oh, and also there's so there's no honors or advanced courses for D1 and D2 year. There are some honors, like you can be like honors endo, honors pros. Like, so if you have certain qualifications, you can get put, it basically allows you to do more complex cases. So if you have something that you are like, if you have something that you are interested in, by the time you're a D3, you can work on like doing more cases. And if you're at a certain point and you express and you've done good in those specific courses, D1 and D2 year, you can express like that you want to do the honors part of the honors program, and it'll allow you to do more complex cases, possibly like externships through Nova with the PG department. Yeah, they're really good though. Like a few friends of mine are going for the honors, like honors endo, and it's cool because it allows you to do more focus like related to that specialty.
Do you know if other schools offer the same thing? I never heard that in any other school.
I'm not sure. A few of the other schools that I was like looking into talked about honors programs and things like that, but I really don't like. Everyone's getting the same education. It's gonna be dependent on you once you get to dental school, how much you like, how hard you work. And you really have to put yourself out there to like, if you want to learn more and you want to do more in a specific, there's professors, they're academics that you can do research with them. They love like students who want more, so like if you want to do that, you don't need a program to tell you you're honors. You can be honors by yourself. Like you can be a badass and be like, I want to do pros, like I'm going to go and annoy this professor every single day and talk about different cases with him. Like you can do that. Like you have complete freedom in dental school to explore your interests. So yeah.
Okay, so somebody asked about the size of the class. Our class has 130 students, 125, 130 students for each year. How many clinical questions do you guys complete throughout the last 2 years? Kyle.
How many clinical hours do you guys complete?
Yeah.
Javier, can you like I don't know really what that's asking. Like how many hours in clinic am I having?
Yeah, how many hours do you spend in the clinic? Like 1,000 hours throughout the 2 years or 3,000 hours? Because I know like certain universities offer more clinical hours. So you spend more time in the clinic and less time in the actual courses and actual lectures.
Honestly, like
I
have no way of answering that like off the top of my head. Like I'm in clinic you can be in clinic every day. Like it's kind of what I said before. Like I have classmates who do the bare minimum, and are only in clinic on their assigned times. And like if you want to like if you want to be in clinic and expose yourself, I can be there every single day, every single second. Like we have night clinic, we have different opportunities. Like I booked a patient last week, requested an appointment when someone else's patient canceled. I was able to take their chair and have that experience, and that was a Wednesday night. So like I don't think other schools are offering more clinical hours than Nova. I think they do a really good job at getting you exposed. COVID has been weird because I mean, we were one of the first, I think, if not the first schools to figure out the question of how do we treat patients safely with this. And they've done a ton of things to install a ton of different protocols, change the entire like clinic, how we were doing things so that we could safely treat patients. And I think a lot of other schools, I know a lot of state schools were very cautious about doing so, but being privately funded, we were able to, you know, to take it upon ourselves to say, hey, we have a lot of patients in need and we're going to treat them. And so I have friends that were out of school for 4 more months while I was sitting in clinic. So, I mean, take that into account. That's 4 months more clinical experience than I did them. And their program might list, hey, we have this many clinical hours. Like, whatever's on a website sounds good, but I don't know. I would just say, you got to show me the data, you know, like, so I don't know. We do a really good job here at getting you exposed, and take it upon yourself to really make the most out of it.
Yeah, that's what I heard. We as D1s, we are not experiencing that because of COVID, but I hear that you can go to clinic, you can shadow, you can be there. Like, it's up to you how much, like, your experience, the experience you're gonna have in dental school is up to you. That's what everybody's telling me, so.
Well, there is a thing that it's also called, you know, hands-on, I would call it. You don't go and just do a fill-in on a patient in D2. You cannot do that, you know, out of the bat. So you have to go and first experience what's having a real person, not a plastic thing with you. So they start, like, you know, scaling up. Like, you see a patient and you learn how to read the history and things like that. And then in D2, D3 already, so you jump into more aggressive and invasive procedures.
I mean, D2, you start of the year, you start treating people, perio patients though. Like,
oh yeah, perio patients, yeah.
You're working on a partner, like a fellow dental student. And then you see real people D2 year for perio, and sometimes what you're seeing is more complex than you thought you're going to see. So it's early exposure. You start assisting, you start shadowing D1 year. A lot of people D1 year, I was in there assisting on like crazy, like, you can be hands-on, you can be in there in the clinic, like all the time.
Yeah, someone is asking, what is a good GPA for Nova? I applied with a 3.7. I don't know, like, if you guys want to.
I had a 3.3 undergrad, like I said, and then a 4.0 in my master's.
Well, I think that's relative. Yeah, I had a 3.8. I didn't have a master's. You know, as you said, Bruna, it's a holistic approach. So they're gonna look at who you are, what's your background, how many how many doctors you've shadowed. It's a lot of things. But I would say the 2.6, 2.9 should not be, maybe.
Yeah, I would recommend. Yes, I would recommend you search online and like search for the averages. Every school has their own averages and try to aim for that. But always keep in mind, there are people that got accepted that have lower scores and higher scores. So if your score is lower than that, don't be discouraged.
Yeah, I've talked to Dr. Lebman, and he's told me personally, like, I mean, there are students that have a 4.0 and get a 26 on the DAT that they reject because in the interview, they have no personal skills. And I mean, this is a profession where you're working with people, and it's a great deal of intimacy for someone to trust you to do something in their mouth that they can't see, that they have no clue about. Like, that's a lot of trust and a lot of, like, you have to know how to work with people. That is a very important aspect. Like, so a GPA and a crazy high DA score, it's great, but if you can't talk to people and communicate and connect with people, it's not going to get you very far. Like, if you're really great at connecting with people and say you've had a few bad semesters of school, that's not going to stop you from getting in if this is what you're passionate about. Like, I would always say, like, if this is what you want to do, like, don't let anyone tell you that you can't do it. Like, 1 semester, 1 year, 4 years, it's not going to stop you from, like, pursuing your dream. Like, you can you can be in these guys' shoes next year, the year after. Like, just go for it, you know, like it's not going to stop you.
Yes. Someone is asking, does Nova supply patients or do you have to find your own patients?
So yeah, so it's kind of, it varies. Like they match you up as a D3 in the summer. They match you up with a D4 that's on your clinic team. So the way our clinic works is we have 8 different clinic teams, and then within that team, you have 2 team leaders who are faculty that directly oversee and like advise you on your group of patients, and then each team has D3s and D4s on it. So the 4th years, I was matched up with one like on my team, and the person who graduated, who was his, you know, big or whatever, graduates and obviously has patients probably that were untreated. Those were given to me. So I came in with like eight patients that were needed to be seen, that were left over from the D4 who was leaving. That's pretty typical. Sometimes if you need patients, there's patients coming in every single day for screening. If you talk to our patient care advisor and say, hey, I don't have any patients, they'll find you patients. But also, they might not find you the best patients. If you have friends, like a lot of people have family and friends that are local, they bring in and screen their own patients. And that might be, it's advantageous to have people that you can bring in, but you'll have patients no matter what. Like, they're not going to leave you with no patients. I had friends who had no patients, talk to someone, now they have plenty of patients. Like, you're going to be very busy.
Would it be good to take 1 to 2 semesters off to do internships and shadowing?
I mean, it depends on your situation.
It's up to you.
If you're trying to just add on to something that you already have on your resume, maybe not. Like, if you feel confident in your resume, I don't think extra shadowing and internships are really that beneficial. Like, the experience that you get in dental school it trumps everything. Like, you can intern with a dentist and be his assistant, and that helps a lot. But it's only going to take you so far. If you feel that you are lacking in other areas, like we've said, it's a holistic approach. If you feel that your grades or something is lacking and it's not quite at the average of what you're seeing on the websites, then yeah, take a semester off, work with a dentist, because I think that's probably one of the best things that you can do. If you're going to shadow, try to find a local dentist. Like during my gap year, I did that as well. Like, I found a local dentist. I called him. I was like, hey, like, I would love to come in and shadow you, and potentially like work for you. He hired me as a dental assistant for a year. And it was like, that's a great thing to put on a resume. But if you're doing it just to add on and like bump up when you don't need it, I don't know. I don't know if it's really advisable. It just depends.
Yeah. There's one question. How do committee letters from pre-health offices stand with Nova? Do you guys know about it?
I didn't do any pre-health like folder committee letters, but I'm sure they probably weigh the same amount as individual letters. I know that you can do it through the portal. I think it was like you can upload your committee packet when they do them. I'm sure they hold just as much weight as individual letters. I'm sure, because in that committee packet that they're going to ask you to get teachers to recommendations, and then the committee's going to write you one whole letter as well. So, but it probably weighs the same amount, honestly.
Mm-hmm.
As you can see, it's a kind of a reoccurring thing that Nova is a very holistic thing, and it's not just one thing is going to kill you versus the other thing. It's truly not. They look really holistically, and if you take it that approach and don't think about like, oh, I need this, like I shouldn't apply if I don't have this. That's not the case. That is totally not the case. Like, if you're thinking you need like 1,000 shadowing hours, you don't need 1,000 shadowing hours. I can promise you. I can surely promise you.
I know how it is because when you're applying, you tend to focus on the negative things about your application. You're like, oh, I got a bad grade on this class, or I don't have this, I don't have that. But guys, don't be discouraged to apply. If you really want this, apply. And you have the DT, you have the scores, GPA, and everything. Don't be discouraged to apply just because you don't have one thing. You know what I mean?
There are things that actually Liebman likes, that maybe you don't have the greatest scores and all that, but very important that you take certain classes he likes. Like I would say immunology, histology, help me out, lost right now. But immunology for sure is going to help you a lot.
Anatomy.
Anatomy as well. You know, that's going to help you out. Physiology, it's going to help you a lot.
All the ologies.
Yeah, microbio. I know that Nova requires microbio, while some other schools don't require microbio coming in. So there's, I mean, take a look at online too, like what they recommend, because they literally I think they put it on their classes we recommend for each school when you're applying to in general. So that can kind of help guide you through what you think you might need.
Mm-hmm. Yes.
Yeah, micro is huge.
It's definitely our hardest class at probably at least D1 year. I don't know if D3, D2, and D3, but definitely probably our hardest class, one that requires no studying time.
Okay. Yeah. Someone asked, can you receive any scholarships for dental school? You do have some scholarships. I didn't get any. I didn't apply to any. I don't know.
There are scholarships.
Yeah. Oh, sorry. Go ahead. I'm sorry.
There are scholarships for sure to be had. There's also grants you can get that you can apply for. But yeah, there is money to be found if that's what you need.
There is a scholarship that my girlfriend got here. It's called a Chancellor's Scholarship. She got it for the second time. I don't know if she's gonna get it the whole full ride, but she had a skyrocketed scores in the DAT, so I don't know. But yeah, we have.
I think they give it to you when you first, your first year, they give it to you based on your scores and your academics and your whole packet. So I'm pretty sure they give a couple people scholarships every year, but it's not crazy. Not a ton of people are going to get scholarships.
Yeah. Is research something that Nova is big on? I don't think. Do you think they are big?
I mean, as far as to get into dental school, or as far as are we a research academy?
I think she's asking to get in.
To get in, yeah.
Oh, to get in, okay. I mean, research always looks good.
Yeah.
I don't know. From my standpoint, the way I see it, I think research, as far as any academic institution, they love to see that. It shows that you, are interested in, because these are all, everyone that works at the school is an academic. They're teachers. So if you are involved in research, it shows that you're trying to progress the field of whatever you're doing. So if you're doing some sort of dental research, then it shows that you want to learn more about it and possibly improve it. That's how every field is. We're not stagnant. The dental field is improving day by day, as well as any other field. The more we learn, the more we have. So if that's something that you want to do, they don't require it, but I think it will absolutely, it'll help you.
And someone just asked, what if it isn't dental research? It's fine. It's fine. If it isn't dental research, it's totally fine.
You're probably not going to be able to do dental research unless you're.
I did research on plants in undergrad, so you're totally fine. if it's anything else other than.
Yeah, but if you don't have research, I got in without research. I know many people that got in without research, so it's something extra, of course. It looks good to have, but if you don't worry. What is a safe number of schools to apply?
Wow, I mean, that depends on person by person, right? And case by case. And it depends how much money you're willing to spend. I mean, the dental school application is pretty expensive, to be honest. I applied to 13, and I thought that was enough for me. I had friends apply to 21, and 20. So, it just, and there's probably people that apply to like 6. So, I mean, Bruna, Kyle, Carlos, I mean, you guys can expand on that.
I applied to 1 school.
Yeah, if you know where you want to go, like,
Yeah.
for me, I knew I didn't want to go to my state school, like, which is kind of weird, you know what I mean? Like, but I knew for a fact that I wanted to get out of Indiana. So for me, it was like more of an explorative process. Like, I wanted to find what the right school for me was. So I applied to like 8 different schools, took interviews at like all over the country. Like, so it's what are you looking for? Like, if you're trying to be like safe and you have the resources to apply to 20 different schools, I don't know, like, that's definitely, you can do that if you want to spend that money on doing that and possibly spreading yourself that wide. It's not advisable, but also I think the best thing to do is do research into those schools, find ones that would be a good match for you and that you would be a good match for them, and then focus in on those. And like we said, make those personal connections, reach out to the school's deans, academic offices, and try to make your name show up in their mind so that when they receive your application, they go, oh, that was the person who called me that one day and we talked about this. Like, if you apply to 20 schools and throw a wide net, but it's just an anonymous application stacked on the 10,000s of other anonymous applications that they're getting, like, every dental school is getting so many applications. Like, unless you jump out to them, like, it's tough. Like, it's tough to get in, but like, find the schools you want to and that you think you would be a good candidate for, and I would focus on them. I don't know. That's kind of what I did, and I ended up here. So yeah.
Yeah, and also don't apply to a school that you don't want to go. Like, if you don't want to live in a certain state, don't apply to that state just for the sake of it. This should be like a nice experience. So like, as they said, most of my friends apply to the average, I think it's 10 schools.
Yeah, I would say 10's like average. I mean, honestly, I probably did it a little overboard, to be honest with you, because once interviews did start coming around, it got to too many, and then you're rejecting them. You're like, why did I spend the money on that? Because like, you start getting interviews and you're spending money on your flights and everything. Like, I mean, I think I got to like 6, and I was like, all right, that's it. Like, and then you get more, and you're like, well, that was kind of I didn't need to apply to that many places because I basically wasted money on those. Yeah. But I mean, like, that's something you have to take into account. Like now looking back, I always say like, maybe I should have toned it down a little bit. But that's just the truth behind it. But it's whatever you really feel comfortable with too. I mean,
yeah, you're going to find a school. Like, I came to Nova and I knew like the day of my interview, I knew that this is where I was coming to school. Like, if you get an interview, like, cross your fingers and work hard to like put yourself in that position. But like, I flew some other places and I was like, I'm not going anywhere else. Like, I'm going to school here 100%. Like, I don't know, it's a very unique like vibe that I got from this school and still get from this school, that like, it's, I don't know, like how friendly everyone is. And like, you go to some places and you look at the students and it's like, not only do they look tired, every dental school student looks tired, like, we're exhausted, but like they look happy. And some other schools you go and like, damn, they look depressed, like they look like they're miserable. Like, I came to Nova, everyone was super nice, like people were joking around and like having a good time. It's a lot about the environment that makes this place like super special, and I think that's what for me made Nova like stand apart. But you'll get to that, but I don't know, if you apply to too many places and you don't allow yourself to like have a connection to one place, then I think you're doing yourself a disservice. But if you think that you want to go somewhere and you only apply to that school and you don't do research of other places, you might cut yourself short of not finding the truly right place for you. So have balance, like anything in life. Just, I don't know, find somewhere in between.
Okay, next question. Do you guys think applying to a lot of schools affects Nova's decision on accepting or interviewing you? No.
They don't get those numbers, I don't believe.
No shot. Yeah, no shot.
They did ask me like how many schools I applied. When you apply, there's a secondary application, right? If I'm not wrong, I think it was on the secondary application.
They do ask you.
Yeah, which schools I applied to. And yeah. But I don't think
they can't see when you do get accepted to other schools, they can see what schools you got accepted to. So like you at that point you can't really josh them around because they know what schools you've gotten accepted to. So if you're kind of like waiting off on it and playing like a little game, they do know once you get accepted to schools like what schools you got accepted to, because it tells them in the Common App that they have. So. But before that, they have no statistics on you. They have no idea.
It's not. They're never going to hold it against you for wanting to explore like different places. Like I said, like Dr. Galka asked me point blank. She's like, "Oh, so you're not going to Indiana?" And I was like, "Absolutely not." She's like, "Really?" I was like, "Okay, yeah." And then she's like, "Have you been interviewing other places?" I was like, "Yeah. I mean, I want to see what's the right fit." And she's like, "Do you see yourself coming here?" Like point blank. And I was like, "Absolutely. Like I want to come to school here if you guys have me." And like, but you know, she's not, they don't care. Like they want to only, you know, they want to get people that want to come there. If you express that to them, then they're going to take you for your word.
I think there's a common theme here that we all have told you guys that like, if you really want to come to Nova, let them know and you make it happen.
Yeah.
Yeah. If there's a takeaway from this, that's the one, guys. Show them that you want to come here, that you're interested. Let me see. Someone asked about the price, but it was answered on the chat. What helped you guys to decide where to apply without ever visiting there? I visited, so I cannot answer that.
What was the question?
What helped you guys decide where to apply without ever visiting there?
Just doing mere research online. I always thought that some of the mission stuff was cool, or like extracurricular stuff that they did, clinic stuff for schools, clinic hours for schools. But then again, like as Kyle said, like you're gonna get your time. So like it's at whether you take your time and you use it, or you know, you do the minimum requirements. I mean,
if you want to be super creepy, you can like look up the schools and find people on Facebook that go to that school and ask them point blank, like, do you enjoy your experience here? Like, I've had people message me on Facebook, like, and be like, how's Nova? Like, I'm like, what? How? Like, but I told them point blank, like, I really enjoy it here. And I didn't like take offense to it. Like you could find people at those schools if you do some Facebook creeping, and I feel like everyone our age is pretty good at that go to that school, and we have no connection to the school. You know, we don't work for the school. Like we'll tell you point blank. Like if I told you I hated it at Nova, I would tell you, but I don't, you know. And so you can do that. You can, you know, check out, but stats, I promise you, stats aren't everything. Like
yeah,
your education is a lot more than what a school offers as far as stats, and especially like, I don't know, like notoriety. Like there's probably people that go to these amazing schools that hate their lives, like, you know, so take that into account as well.
Yeah, it's so nice to like go outside and see palm trees, go to the beach, you know. And our campus is beautiful. I don't know if you had the chance to go to our sim lab, but I think it's one of the nicest sim labs I've seen.
For sure. Like when you're going around to other schools, I mean, like Nova definitely sticks out. And I think when you guys do your interviews, you'll definitely see that. And knowing that, I mean, your first 2 years of dental school are going to be tough. So you definitely want to be in a place where you're going to be happy. And and be surrounded by awesome people too at the same time. And that's something you really got to take into account. Like, you're going to get your education everywhere you go. You're going to come out a dentist. Everyone graduates a dentist as long as you pass. And let me tell you, they're going to make sure you pass. So, like, that's something you should always take into account. Like, what are you happy? Are you going to be happy there? That was always my first priority when I was going to do, like, applying for dental school. I was like, am I going to be happy here? Like, when life gets tough and low, are you going to be happy? And I'm so happy I made the choice at Nova, truly. And I've met some amazing people so far.
And I think that was it, guys. I don't see any more questions here. I was thinking, should we write our emails on the chat so people can email us, or like Instagram? You guys can send us messages about your situation and we can see if we can help you out.
I think that'd be great.
Yeah? What do you guys prefer? Instagram?
Emails.
Email?
I'll do email.
Maybe
Email?
if
Okay.
that's okay.
I'm sorry?
Maybe both, if that's okay. And
Yeah, sure.
I have like one more very small, quick question. Is there in-state tuition for private dental schools, or?
For Nova, it's about $1,000 or so for if you're in state. It does, but for most private schools, you're not going to get like that kind of in-state tuition. It's going to be the same generally for everyone.
All right, thank you.
Mm-hmm.
Okay. Yeah. Okay, guys, so feel free to reach out to us. If you have any questions, we'll be more than happy to help you. I know it's a tough process. I was lost so many times, but you can do it. Just keep doing what you're doing, and you're gonna get into your dream school, I'm sure.
Yeah, guys, like, I mean, I think the best way to do it is just take it one step at a time. Like, it's with everything. Like, do something right tomorrow and the next day and the next day. And before you realize it, like, you'll be in the position you want to be in. And if you have one like bad day or one bad test or whatever, like, don't let that stop you from doing what you want to do. Reach out to people, ask for help. Like, everyone, I want to help you guys. Like, I want to, you know, everyone, like all the D1s, all the D2s, everyone in our school, the faculty, we want to help you. Like, we want you to be in our shoes. Like, we love this profession, and like, no one's going to stop you. We're all here to help you. Like, every single day is an opportunity to like get closer to your dream, but don't freak out about the little things. It's such a long race and such a big picture, like, that I think people can get caught up on small things and such the fine details, but enjoy the ride. Like, it's crazy. Like, I'm a D3 year now, like, year's almost halfway over. I'll be done with dental school soon, and like, I promise I'm gonna miss it. I think back to when I was applying, like, oh my God, like, it's crazy how fast time flies in dental school. So enjoy yourselves and just like make the most out of this situation that you're in, because it's very unique, and don't let it stress you out too much. Like, take your time and just know that, like, at the end of the day, you're gonna be able to make it happen. You'll end up where you're meant to be no matter what, and that's for the best. So just keep working hard and like ask us for help, reach out to us. We would love to help you.
Guys, honestly, people used to tell me that people in Nova are friendly and everything, but I didn't think they would be that friendly. Everybody here helps us so much. You have no idea. Like, all the D2s, D3s, D4s, they give us so many tips. Like, it's really a unique school. I don't think other schools are like this, honestly. So feel free to reach out to us, and I want to wish you luck in this process, and I hope to see you here with us soon.
Yeah, guys, back off that. Same thing. I hope to see you guys here soon. You guys are more than welcome to reach out to us. if you guys want like anything, we can take you around sometime. If you guys are ever here on campus, just let us know because we're always going to be on campus. But yeah, good luck, everyone. Keep grinding, keep doing your thing. I know you guys will do it. If your heart wants it, you're going to get it. Like I assure you it. I assure you it. Truly. Like people always, especially someone from a master's, like I saw some people in some crazy situations and they pursued and got there. They truly did. And some all around crazy situations. So you can do it. You believe in yourself, do it. You guys got it. I promise you.